Hello, everyone. Topic is visual impairment. I am Derrick Jackson. So, visual impairment, what is it? Visual impairment is a term that experts use to describe any kind of vision loss, whether it's someone who cannot see at all or someone who has partial vision loss. Some people are completely blind, but others have what is called legal blindness. Reduction in vision that cannot be achieved with standard glasses or contact lenses. Reduce a person's ability to function at certain or all tasks of daily living. Visual impairment can also be caused by trauma or stress and nerve disorders in the body. Visual impairment affect can affect people. Different types of visual impairment are blurred vision, loss of peripheral or side vision, loss of central vision, which creates a blur or blind spot, but side vision remains intact. Like blindness, probably from beam lights when driving, and extreme light sensitivity. So for prevalence, the population that's most affected by visual impairment is adults. According to AFB.org, visual acuity is a number that indicates the sharpness or clarity of vision. Visual acuity measurement of 20 out of 70 is the most accurate. A visual acuity measurement of 20 out of 70 means that a person with 20 out of 70 who is 20 feet away from an eye chart sees what a person with unimpaired or 20/20 vision can see from 70 feet away. So the 20 out of 70 that's on PowerPoint does mean on a basic eye level chart that is the third line, and a person who sees 20/20 vision would be able to see the eighth line. The letters are really big. The third line. Approximately 12 million people 40 years and over in the United States have vision impairment, including 1 million who are blind, 3 million have visual impairment after correction, and 8 million who have vision impairment due to uncorrected refractive error. Some common causes of visual impairment are uncorrected refractive error, and that is when the eye cannot clearly focus the images of the outside world, or blurred vision. You have glaucoma, which is damage to the nerve connecting the eye to the brain caused by increased pressure in the eye. You have diabetic retinopathy, and that is damage to the blood vessels in the tissue in the back of the eye. You have corneal opacity, which is loss of normal transparency of the cornea. You have cataracts, which is most common, and that's clouding of the lens of the eye. Age-related macular degeneration, and that is deterioration of the central part of the retina. And you have trachoma, which is a roughening of the inner surface of the eyelids. So you can get trachoma from rubbing your eye too much. Epidemiology. That is so for epidemiology, a way to help visual impairment is to see an optometrist. A person who specializes in optometry deals with a branch of medicine that involves examining the eyes. They also have some visual systems that can help abnormalities and defects, as well as medical diagnosis and management of eye disease. If an optometrist determines that you do have visual impairment, they will have many treatments available for you. Some options are you can get glasses, which I'm wearing. You can get the contact lenses if you don't really like glasses, or if you don't like neither or, they can prescribe you with eye drops and other. If the visual impairment is more serious, surgery may be needed. Some surgeries that can be assessed are cataract surgery for cataracts and a vitrectomy, which helps repair sight in blind individuals. Surgery entails that it removes the jelly-like tissue behind the lens of the eye. And how does visual impairment affect the exercise response? Well, visual impairment can affect it in different ways due to the fact that your eyes are a very important attribute to exercise. Eye loss is very important with daily activity because you have to use your sight in order to exercise, whether it be, picking up a weight, grabbing a barbell for a squat or walking on the treadmill, you know, getting on a stationary bike. And some studies have shown that individuals with visual impairments, especially in children, tend to have a lower fitness response than sighted peers. But it doesn't mean that they can't exercise. It just means that they probably are going to need more attention when performing exercise. And the good news is that visual impairment typically don't affect the benefits that can be derived from regular physical activity. Most people who are visual impaired fear and have a lack of confidence, and those tend to be factors that prohibit people with visual impairments from becoming visually active. As healthcare providers, it is our job to create exercise prescriptions that increase the benefits and have low risk of injury. Pharmaceutical indications, there really aren't any pharmaceutical indications for visual impairment, but it is important to determine other health concerns or chronic diseases that could present or could pop up, like diabetes or hypertension. Um, if no health concerns are identified, exercise guidelines for more healthy populations can be registered. Um, if a person is certified as sight impaired or partially sighted, you have to fall into a category in the following: while wearing glasses or contact lenses. And those are visual acuity of 360, which is blindness, or 660, which is full field of vision, which is moderate or severe uncorrected refractive error. Some medications for the following causes of visual impairment are latanoprose, tafloprose, and travoprose, which are eye drops that help glaucoma. You can also uh, control diabetes, which helps prevent diabetic retinopathy and resulting any visual impairment from that, as well as just surgeries if it gets really severe. So, for glaucoma and uncorrected refractive error. These are some graphs I picked out. The one on the left is a graph for proportion of total vision impairment. It has two separate graphs for moderate and severe vision impairment, and on the right it has blindness for the common causes, which is diabetic retinopathy, glaucoma, age-related macular degeneration, residual cause of vision loss, cataracts, and undercorrected refractive error. So the y-axis shows age, and it gets higher and higher. Most common for moderate and severe vision impairment, the percentage would be for undercorrected refractive error. It has over a 50% change in people who are in ages of 50 to 59, and it slowly it decreases as the ages get up. For blindness, cataracts has the highest percentage, and then it goes to residual cause of vision loss, and then probably glaucoma. The second graph shows how many people are just going to be visually impaired as time passes. So in 2010, it was only around probably like 4,000. In 2030, it's supposed to be above around probably 7,000. And by the time we hit 2050, it's supposed to be above 12, so around probably like 13,000, which is a lot of people who will be visually impaired. And it has the different ethnicities. It has for whites, for blacks, Hispanics, and other. And here's the case study I had. Miss B is a 65-year-old woman. She lives at home with her dog. She walks the dog twice a day through her neighborhood for 15 minutes. She loves to play with her grandkids when they come over, but cannot for long because she's out of shape. She has not worked out in years. She does not own any glasses, and her vision is not the same as it used to. Her sight tends to be very blurry, and balance tends to be unstable at times. B wants to exercise but does not know where to start and is afraid to go by herself because she feels that she will hurt herself since her vision is blurred. She is not on any medication for her eyesight and has a heart rate of 90 beats per minute and blood pressure of 130 over 90. She does not have any medical conditions other than high blood pressure. Her heart rate appears to be normal, but her balance is a concern. So for the exercise prescription, I would give her, of course, ask, talk to her individually, because when dealing with people who are visually impaired, you want to talk to your client to discuss exercise plans with their doctor, because some medical eye conditions can be affected from strong weightlifting, heavy weightlifting, bending, and just fast, rapid movements. But for Miss B, since she has not worked out in a very long time, I would work with her one on one so that she is safe and she feels okay with me. She is okay with me working her out. Then just giving her an exercise prescription.